Good afternoon, Emma.
Hi.
Delighted to talk to you this afternoon. You've kindly agreed to come and talk to us about End of Life Doula UK and share your experience with us. We're really pleased to meet you and really pleased that you've volunteered to help us with this series of podcasts that's going to be broadcast over Dying Matters Week. So welcome this afternoon.
Thank you very much for having me.
Perhaps if we could just kick off with you telling us a little bit about End of Life Doula UK and maybe what a doula actually does, which might be of interest to our listeners.
Thank you. Sure. I'll start with what a doula does, if that's okay.
Yeah.
So it's quite hard to succinctly describe what we do in a sentence, and the whole reason for that is because our role is supposed to be flexible, and it looks very different depending on who we're working with. So an end-of-life doula is set up through their training to be comfortable talking about death and dying, which obviously some people can find very difficult. And we do, to use a doula term, hold space for those sometimes difficult conversations, but very important conversations. And we aim to offer kind of practical, emotional, sometimes spiritual support to the people we're supporting. And I suppose in those first few meetings with a person and those around them, so we don't just support the person who's at the end of life, we also support their family, friends, whoever's important to them. We're always listening out for any gaps in their existing support. So maybe they have really great emotional support from their family and friends, but there's some practical things that they really need some help with. There's a lot of unfortunate paperwork that comes at the end of life just when you need it the least. So we can help people with things like that and advanced planning. Or it might be that they have loads of practical support around them, you know, when people go into kind of doing mode, but they feel there's nobody, and sometimes nobody neutral, that they can talk to about their fears about dying. So in that case, we would fit into that role instead. And then in terms of as an organisation, so we have just over 250 members now who have all trained with Living Well, Dying Well, the training body in the UK. And we act as a membership association, so we support our members to practice. We offer them training and support, mentoring to all doulas who are practicing, because we think it's really important to have an outside person to support you if you're supporting somebody. But then we also act as a central point of contact for people who are looking for support in the UK as well.
So how might people come across you? I guess is the first question. Where might they find you?
Good question. So, well, I suppose two main ways. A lot of people do just Google end of life support, end of life doula. Sometimes people use the phrase death doula, and find us that way through our website. But also in a more sort of organic way, all of our doulas aim to put themselves out there within their communities and let people know that they're there. So it might be that it's word of mouth through the community, through a church group, through a community organisation, through other third sector organisations who know we exist. And then increasingly, which we're pleased about, and highlighted by being here, I guess, NHS organisations are knowing that we are here and being open to collaborating with us, because we very much, I think there can be a bit of a misconception that we're somehow opposite to medical support, and obviously we're not a medical role, but everything we do is about working alongside the person and working alongside other roles, all for the kind of benefit of the person, if that makes sense.
Absolutely does, yes. And I guess some people might get the term mixed up with midwifery doulas, because that's certainly where I first heard about the role of the doula, and it wasn't until I started working once in a hospice that I heard about the role of the end-of-life doula. So could you just tell us a little bit about how you found yourself working within the organisation and what your training was like, and maybe some practical experiences you've had along the way?
Yeah, sure. So I came into the role, I did psychology as my degree, and then I started doing domiciliary home care. And being straight out of university, I a bit thrown in the deep end, didn't realise that a lot of the people I was going to see at home were on, fast track programmes where, in the last few weeks of life. And the thing that struck me most was how many people how the communication had just totally broken down for a lot of people. So you'd have the person who was dying, their usually family, and the healthcare professionals trying to support them. And nearly everybody I went to visit, there was some barrier where the communication had been lost, and that was really negatively influencing the care that they would receive. And sometimes it was, I guess, simple things that we all do, and we think, oh, you know, we'll talk about this when we need to talk about it, and then the time comes and you still haven't spoken about it. And particularly to do with people's wishes and preferences, I think people often saw me as a neutral person coming in, as somebody they could just offload and say, oh, you know, I want this to happen, but I don't feel comfortable telling my family. And then I'd go in the other room and the family would say, you know, we just want to know what they want, and we'll work with, but they just weren't talking to each other. And I suppose realised that I was very lucky to be from a family who does talk about things quite openly, and I became really interested in how we can improve the communication. And then I just stumbled upon Living Well, Dying Well training, I think on Twitter, and again, never heard of the doula role. But I initially just thought I'd do it as CPD to complement my psychology work. But the training, and I think this is something a lot of doulas would say, that it was really life-changing, in that unlike other training where you go and you're given skills, knowledge, factual information to go away and do things with, end of life doula training is such a kind of journey into yourself, which makes complete sense now, because obviously to support other people with death and dying, I think we need to have confronted it ourselves and what it means for our own mortality. So it's a lot of reflection, a lot of talking about your own death, a lot of thinking about your own wishes and preferences, because we really believe that we can't say to other people, oh, you need to talk about this, and then not do it ourselves. So yeah, as soon as I'd done the first part of the training, I just thought, oh, this is something I really want to do. But to be honest, back then, I think that was maybe 2017-ish, it wasn't really a viable role you could do as a job. I think most people were doing it voluntarily, and not many people would. Well, I say this, I think it's important to recognise that this work has been going on probably since humans began, you know, just maybe without the label. But in this sense, there wasn't many people practicing. And then I guess I've been lucky to come to it at the right time, when there's been awful things over the past few years, obviously, that have contributed to why the awareness of our role has grown, I think. So, you know, with community services being so stretched, with the pandemic, with there being a bit of a all hands on deck feel to end of life care, I think if you went back a few years, there was a lot of occasions where it felt a bit like the door was closed when we said, hi, we're here. But now that seems to be improving a lot, so it's changed.
You talked earlier about working collaboratively with NHS organisations, and I guess with social care as well. Have you found that over the last few years that relationship has improved and grown as more people have become aware of the role of the doula, and particularly End of Life Doula UK, and a trusting relationship has been built up? Because I could imagine that there might be a little bit of resistance on behalf of some healthcare staff, clinical staff, professional staff.
Mm-hmm. Yeah, I think it's improved greatly for many reasons. Like I say, I think one of the reasons is that on our kind of side, we're always treading this line of, we don't want to be over professionalized and lose what makes us unique, that flexibility, and, you know, we don't want to turn into being kind of target driven and that kind of thing. But at the same time, we want, having worked in the NHS myself, thinking, you know, would I refer a patient to an end of life doula? You want to know that person's going to be safe, they're working with someone who knows what they're doing. So at the same time, we, you know, make sure people know that we have safeguarding procedures, that all our doulas are mentored, like we say, DBS checked, that kind of thing. So I think it has been a slow chipping away, like you say. As soon as some people were open to working with us, there was a handful back in the beginning, who very grateful to them, of GPs who were quite open to different ways of working and thinking how doulas could link in with their surgeries, and from them, and some hospices too. And from them, we then started getting feedback from doctors, nurses, district nurses, saying, oh, having that end-of-life doula there was helpful for the person, but it was also helpful for me as a doctor or nurse, because I knew that those things that unfortunately healthcare professionals would like to do, can see need doing, but don't have the time to do. They can rely on us to do it, and then make sure that we're feeding back to them and the communication's all open. So I think it's snowballed from there. We've then, been invited to speak at nursing conferences and that kind of thing. And I think the credibility of and helped by the organisation, I think it's reassuring for people to know that there is we're not a governing body, but we're, like I say, a membership organisation, and we do have standards. So I think that's all of that has contributed to why we get a lot of referrals from healthcare professionals.
That there are standards of practice and therefore a register, I guess, of all doulas that work with the End of Life Doula UK organisation. So
yes,
people
list of our members.
Yeah, okay.
And I was just going to quickly ask about going about that register, because so what sort of people are your doulas? Are they literally from a wide breadth of society? And exactly that, think about the register is that, so if somebody was approached to say that they were a doula and the family wanted to check, they could also contact you to say, can I just make sure that they are registered with you? So there is a process to ensure safety.
Yes, that makes sense. So on your second point, the vast majority of our referrals, people seeking support, come to us centrally anyway, so then that they know that the people we're matching them up with locally are members. But yes, people can absolutely check because also our doulas are out in their community saying, hi, I'm here. So if anybody wants to check, they can definitely contact us. Of course, there are end-of-life doulas working who aren't members of End of Life Doula UK, obviously, but in terms of who have their own processes and things. But we put a lot of work into not standardization to lose the uniqueness, like I say, but the kind of safety and reassurance aspects. And I've forgotten the first part of your question. I'm sorry.
What sort of people are doulas?
Oh yeah,
who do you attract?
Good question. And this is where we really put our hands up, I think, and say that it's changing and it is improving, but in terms of the diversity of our members, we have some way to go, I think. And I think that is because of what I was saying before. When we started out as an organisation, most people did this as a voluntary role, so that kind of inherently attracts people who have a lot of time, who can do unpaid work, who often, were retired and just looking to do some volunteering. So when I joined the organisation, the vast majority of our members were retired white women, to be quite honest. Not that there's anything wrong with that, but there wasn't the breadth of diversity. And I think that is something that has changed a lot, and something that we've noticed changing recently. Firstly, because Living Well Dying Well, the training organisation, offers bursaries for training now, which opens that up to a lot more people. They also had to move a lot of the training online during the pandemic, which I think initially they and we thought, oh no, you're going to lose some of what we all had in the face-to-face training. But actually, it's worked brilliantly, and it has meant that a lot more people can access it, which is brilliant. And I think the final thing about it now being, particularly in some areas where we're linked to NHS trusts, for example in Leeds, where doulas are paid as part of a project, although the vast majority of our practicing members now do this as a paid role, because we've put a lot of work into ensuring that we have a pot of money, so that if the person at the end of life can't pay for doula support, then we will pay the doula. So we never want ability to pay to be a barrier to access and support, but it means that the doula can still do this as a paid role. So I think that's made it much more viable I know I found that personally as well. I was about 27 when I started, and I had rent to pay, and I think not just me, but I felt a real need to push to say that just because you need paying to do something doesn't mean you're not passionate about it. That I think I don't mean just in our organisation, but I think, going off on a slight tangent, that sometimes volunteering can be a bit of a closed door to people, because there can be this feeling of, if you're passionate about contributing to a cause, you could do it for free, you know, and that isn't always the case. So I think that has made our membership increasingly diverse, which is great, and that also means that we're seeing more diversity in the people coming to us for support as well.
Yeah, as I was saying, sustainable, wasn't it? Because I think otherwise the problem is goodwill only lasts a certain amount of time, doesn't it? And we all know, I mean, both Joe and I have worked within acute hospitals and hospice, and volunteers are a big part of the organisations, but it is people have difficulties. They can't always do it. They have other, you know, health conditions, or they need to earn money. You know, it's such a changing workforce, isn't it? So for you, I guess, for that sustainability and that consistency of approach, that having a salaried person means that you're much more likely to continue for a longer period of time and retain those staff that you've invested in to provide the support.
Yeah, I think so. I mean, all of our members are still self-employed, so we still don't have any employees, but it does mean that, yeah, they can, not, as I say, it really depends on the area and how many people there are looking for support in the area. In terms of, I don't think we'd be at a point where we could guarantee we'd always be able to link people up with a ongoing flow of kind of people looking for support, but certainly in some areas where it's really taken off, that's working really well.
So, Emma, you mentioned a few minutes ago about the fact that access, you know, funds aren't a barrier to access for people if they need the support of a doula. How does End of Life Doula UK obtain those funds? Is it a charity? Do people donate, or does it come through subscription? I just wanted to understand how that might be possible.
Yeah, so we're not a charity, we're a community interest company,
Right.
and that basically means that, you know, money we make needs to go back in, be invested back into supporting our members. So it's a mix, really. Yeah, all of our members pay subscription, which contributes, but we do get donations from people who've supported. We get donations from other organisations. Yeah, we do rely a lot on fundraising, and so that is something we're always having to push as well.
And can I ask probably what is going to be a very obvious question for people out there? What might be the rate of cost for somebody to invest in and having the support from an end-of-life doula if they wanted to?
So as I say, all our members are self-employed, so they can technically charge what they want, but we recommend generally £20 to £25 an hour. Right. And we also really recommend that people don't lead by saying necessarily this is how much it costs, but start by talking about what a person can afford, what their budget might be, whether that's feasible. We don't want there to be any pressure, right? You know, not to give people something else to worry about at a time when there's already so much going on. So we'd always start by asking what is the person's situation, and then if they need it, we might subsidise the support entirely as an organisation. We might provide half and they provide half. We find generally that people really want to pay if they can. I think for a few reasons. I think they want to support the work, but also I think there's something in all other relationships we have. We understand the nature of kind of a transaction where you're getting a service for what you're paying, and this isn't to say that everybody charges, because there are a number of our members who work voluntarily, and that's absolutely their decision, and also has great benefits for people there as well. But we do get feedback from people to say that they find it reassuring to know that, you know, they're paying, they're getting this service, whereas when you're just doing it voluntarily, I think as doula you have to put in extra effort to kind of keep the boundaries really obvious, especially if you're working with a person, a family for months, years. You don't want to kind of stray into like a friendship relationship, and that's something that we cover in the training. Yeah.
Can I ask another practical question? You talked a bit in the beginning of the session about some of the support that you offer in terms of practical support like paperwork and emotional support. Would an end-of-life doula, once they've built a relationship with that person, if that person lived alone perhaps, be able to be available during the active dying phase to sit alongside them, hold their hand? Is that part of the role as well? Because I'm sure that many people out there wouldn't be really clear on that. Often people want to die at home, but feel that they can't because they live alone, for example, and there's nobody to be alongside them and they don't want to be on their own. Is that something that you do? Perhaps you could talk us through maybe some examples of people that you've helped, obviously keeping it anonymous, but some kind of stories about the sort of support that you give.
Yeah, definitely. I think for one reason or another, most of the people that contact us tend to be sort of adult children of the person who is dying. So I'd say the majority of the time there are family members around. And in those cases, I mean, our training absolutely does cover how to, hold vigil, how to sit with a person, how to recognise signs of dying, which is something we often talk a family through because they're witnessing it, and it can be really easy to misunderstand what you're seeing and potentially, there's a lot of symptoms in the dying process, as you'll know, that are sometimes more unpleasant to witness than to perhaps experience as the person themselves. And I think the sitting with can become a smaller part of the role than people realise, because we do find that when people contact us initially, particularly families, they ask us those questions, can you sit with them? Can you hold their hand? Can you, and actually, I don't know if it's how different doulas work, I guess, but I certainly always make an effort to gently support them to do it themselves, because I personally, I wouldn't want to look back and think that, the doula did all of that, when actually there can be some beautiful moments there if you can support people to feel empowered to do that. But for people that are on their own, yes, definitely. So it's something that we're finding, particularly in Leeds, where we're working through the NHS Trust, people who are wanting to remain at home. Sometimes they have a lot of in disadvantaged areas as well. I know colleagues of mine have provided practical support you maybe wouldn't normally think of, particularly around selling a house, moving into a care home, practical things around the house, cost of living, keeping the fridge stocked. But yeah, being with them at the very end of life, it is, you probably know, but I'd say particularly difficult to keep people at home if they are alone. It, unfortunately, wish it was different, but a lot of the system at the minute requires really strong advocating for that to happen, and as doulas we aim to be those advocates, but I think that's one reason why we would be pulling in as many other services to make sure everybody's on the same page, to make that as likely to happen as possible, I suppose.
It's interesting, isn't it, that when you look at the statistics, many people say that they'd like to die at home, and sometimes despite all the odds people do, but often there are barriers in the way that prevent that from happening.
Yes.
I can ask about is it across the country, I guess, that people can access end of life doulas? I mean, obviously it's great that you're doing some work obviously with Leeds. That sounds really interesting, and that might be a conversation for another time around how that works, because it's that's quite a different model. But if people want to access, and they're not known through the GP or anything like that, how, obviously they've gone on your webpage, but do you cover pretty much everywhere in the country?
We aim to. That we're still little pockets where we don't have people that are trained. Certainly big cities tend to be fine. We have a lot of members in London, Leeds, pretty much all. I'd say Wales and Scotland, and definitely Ireland at the minute are quite sparse in terms of how many doulas we have, but the demand for the training has also shot up. So it could be that if somebody contacts us now, it might be that next month we do have somebody there. So I would say if we don't have somebody in somebody's area, then definitely if time allows, obviously, then get back in touch with us. But also it depends. Some doulas are very happy to travel a number of hours. So when I started, I lived in Leeds, but I used to cover all the way up northeast, Newcastle, and obviously there are restrictions there about how quickly you could get to somebody. But in general, sometimes doulas will mix a bit of remote support as well as in person. Certainly people can find it reassuring to have somebody they know is on the end of the phone. So sometimes you don't actually need to be there in person to offer the support as well.
Yeah, I think that's helpful to know, and it might be that how we can help support you to get, hopefully this video or podcast will help with put more people wanting to come and be an end of life doula, because obviously I guess we're always keen on having more people coming and joining you, so that you can support more and more people. So I'm sure that's something that we can help with, and we will spread your word, across with the podcast.
Excellent. Thank you.
So, I mean, you talk about obviously experience, and is there anything else that you could sort of say about the benefit that people have said to you? Oh, thank goodness, if we didn't have an end of life doula, that this might have happened or not happened. Because it's funny, because I had assumed in my head that you were there to provide sort of physical care as well, but obviously you're very much around the psychology and the talking and the supportive rather than physical care. So that's something I've learned today in my ignorance. But yes, anybody, have you got any, say Joe's asked before about examples of the impact that you've had?
Yeah, I think, I mean, that's just my description of my practice, I suppose, that I don't merge my psychology in with the role, but coming from a talking therapy perspective, I guess I tend to do focus more on maybe the situations where there's difficult family dynamics going on, where the family needs somebody to kind of come back to what's important right now, park things that we're not going to fix right now. But some doulas certainly do focus more on kind of the practical support. So it just depends on what the individual doula nearby is providing, I guess. But yeah, in terms of examples, I think I do tend to gravitate towards people who are looking for support with difficult, I said in the beginning, I came into this work because I saw communication breakdown and I wanted to improve that. They're the ones that I find most satisfying, and they're the ones where we do get a lot of feedback saying that having somebody there who was neutral, who was not in a really set predefined role, who was just obviously other professionals come in with an agenda, they're doing a task or something and then they leave it. They might obviously have a supportive chat around that, but they're predominantly there for that thing. I think having somebody there who can kind of slot in and be there to provide overall perspective. Doulas usually, as part of their training, know how the local health and social care system works, which can be super difficult to navigate. So again, we're always listening out for where we can guide people, where we can connect people up with other services, and open up those conversations, I think, is particularly around advanced planning. That's something that usually comes out in the first few meetings with a person, because often people are more comfortable maybe talking about what they don't want compared to what they do want. So you might meet somebody and within the first hour or so they'll say, oh, one thing's for sure, I don't want to end up in hospital again. And then you can go from there and think, is there documentation we can put in place to make that as likely as possible to happen? But yeah, the feedback we get is that doulas, I'm going back to using the treading the line analogy again, because we're always kind of, I call it shifting gear between knowing when to blend into the wallpaper and let a family or friends do what feels right for them. I really believe that around death and dying, people often know what they want to do. They know what feels right for them. They know, particularly after somebody's just died, in terms of maybe honouring them or taking a moment with having the body at home, which we support people to do. I think people often know exactly what they feels right for their relationship with the person. They just need permission. So one of the first people I worked with who was in a care home, the gentleman had just died and his wife was there who I was supporting, and I said, she was like, well, what do I do now? And I said, well, what do you feel like doing? And she said, well, to be honest, I just wanted to get on the bed and give him one last hug, and just have a moment with him. But she said, am I allowed to do that? Is that? And I just really got me. I thought, gosh, to think you wouldn't be allowed, like, of all the things that are just natural and normal to do, so often we're there to give permission and say, absolutely, whatever feels right to you is the right thing to do. And yeah, provided overall perspective as well. Going back to the difficult family dynamics thing, I've definitely had quite a few clients where there's been understandable disagreement, really serious disagreement around a person's wishes, around what everybody thinks is the right, should their parent be in a care home, should they be at home? And everyone's got a valid opinion. Everyone's got an opinion that is based on their relationship with a person. I think it's easy to forget in a family, isn't it, that you've all got a slightly different relationship with the person, you all have slightly different priorities. So I've done a lot of work where it's been a bit of a blunt agreement with them at the start, I guess, where I've said, look, it sounds like it would be helpful if I constantly just brought us back to the present and said, all those things that are bubbling up from 20 years ago, we're not going to fix those right now, but we are all here with one shared aim, which is to, you know, give your mum the best few days, weeks as possible that she has left. And so yeah, we get feedback to say having somebody to firmly but gently help people focus on the now is really helpful.
Kind of almost sounds a bit like an end of life brokerage, isn't it? It's bringing people together and helping those relationships and putting people in touch with the right people at the right time, I guess.
Yes, and it fits with what I was saying before about working alongside other, because we're absolutely not trying to replace anyone. I know when you were saying about we do come across this feeling, I think particularly if you went back a few years, maybe when we were approaching hospices and getting this feeling of we already do that here, thank you, and I'm sure they do, you know, healthcare professionals doing a fantastic job in difficult circumstances, but it doesn't mean there isn't also a role for us to fill the gaps, you know. Yeah. I think it's helpful for everybody, but I would say that I'm biased.
Well, as I say, time is the biggest challenge for clinicians, and you probably have the luxury of a little bit more time.
Yes, very true.
I think conscious of time, and I think that's really possibly a good place to kind of end the conversation, but also thank you, Emma, for joining us. Is there anything left that you haven't said that you'd like to say about End of Life Doula UK or the role of a doula before we close?
Good question. Well, thank you for having me. And as I say, I'm just one member of End of Life Doula UK, and there are many of us now working out there in communities doing this in their own way, but all under the same umbrella. So if anybody is interested in hearing more about what we do, then we'll have a doula local to them who can speak to them, connect with them, go and do a talk. We don't just provide one-to-one support. You know, many of our members run death cafes. They do talks in the local area. So yeah, speak to us if you're interested, is what I'm saying. And thank you again for having me.
That's fantastic. You know, our aim from this session and this podcast is to make sure that this information gets out wide and far, so that more and more people are aware of the role of an end-of-life doula and how much support you can offer to people. So thank you so much for joining us today, Emma. We're really, really pleased to have had you with us. Thank you very much.
Thanks for having me.